Okay, as you will all have just heard, we're now recording. So welcome everybody and thank you for being here today. We've currently got 167 participants, which is fab, and just shows that we're all hopeful of the information that Mike is going to give us once he's here. He's not actually here yet. So just a quick reminder that if you keep yourselves on mute, but if you do want to say something, if you could either indicate by putting your hand up or putting something in the chat, and then you can unmute yourself to speak. That would be really helpful. Just with so many people on the call, it makes it difficult to see who's wanting to say something. So thank you for that. Claire Kershaw unfortunately isn't with us today, but we have Catherine Hutley and Anita Kemp who is here in her place. So thank you very much to both of you for agreeing to attend. As I say, Mike isn't with us yet, but we're hopeful that he will arrive soon, and then we will get some information and answers around his thinking. So Catherine or Anita, is there anything that you want or needs to say at this point?
I'll just come in there to welcome everybody back to the new year, as I know Claire would want us to do. It's wonderful to see you all, and we hope you did manage to have some time to rest and recuperate with your friends and family over the festive period. We are very, very aware that this is yet more very challenging times. Things seemed to be relatively calm last week from our perspective, but certainly things are coming through now as more and more cases come through and difficult decisions have to be made. So please make sure that you continue to use school comms and your SEP and AD for support and advice, and carry on doing a wonderful job. And hopefully, as you say, Mike will also join us to clarify some of the public health messages in a moment. Anita's thank you, Mike. Anita's officially deputising for Claire this week, so I'll just hand over to Anita. Anita.
Hello, everybody. I'm not sure all of you know me. So I'm also on Claire's senior leadership team as head of strategy planning and performance. I think Catherine was eloquently welcoming you back after the Christmas break as well, and I see Mike has arrived, so I think we're in good hands now.
No, you're not.
Don't be like that, Mike. Of course we are. So Mike, can I just ask you to sort of outline where we're up to and your thinking, and then we've obviously got the questions and some things going in chat that we'll need to ask you just to cover.
Yeah, thank you. So the position broadly with the COVID situation is that the levels of cases within Essex, due to the high infectiousness of the Omicron, are way higher than they were this time last year. So we've had rates of around average 2,000 in Essex, which is going. It's not quite double our peaks last year, but it's going on for that. However, largely due to the impact of the booster program, the impact on hospitals has been low, and the impact on intensive care units of hospitals has been extremely low. We haven't actually seen, touch wood, and I think it's still a bit of a touch wood, but I think we're getting there now. We haven't actually seen any increase in intensive care beds use through COVID at all over the last month or two, which is great. So the main reason for that is the boosters, because the boosters actually reduce your chances of being admitted to hospital by just under 90%. But also the Omicron in itself is not as serious a condition as the Delta variant. It's about 30% as serious. Certainly it's about 30% as many hospital admissions. The pace of spread is quite high. In terms of hospital pressures, which are the key thing driving government thinking, that's likely to go up somewhat until probably about mid-February and then drop off again. But the rates we're seeing increase are not horrendous, and actually quite, I say, particularly importantly, that the impacts on the intensive care are not being high. The NHS, however, also challenged by other issues around the level of illness in the population at the moment, but also, as with yourselves, I'm sure, high levels of staffing absence. So at the moment, there's roughly about 6%, and you compare it to yourselves, total absenteeism within the NHS, of which about half of it, about 3%, is due to COVID. In terms of restrictions, I don't think we're going to see any further restrictions. You might see some relaxation of restrictions over the next few weeks, which I think would certainly start with masks in secondary schools. I think that would be the first thing to go really within in that ask. In terms of boosters in the future, I think once the wave passes through, which it will by about February, and then it'll fall off in March. After March, Omicron's going to hang around. We're going to start to see small outbreaks of Omicron here and there. It will mutate again, and we'll end up with like son of Omicron, daughter of Omicron towards next winter, and cases to go up again. It's likely that by that time we will have strong polyvalent kind of broad spectrum vaccines in place, which will deal with several variants at once. And I think that'll help reduce the pressure due to these things. So I think short of, and I can't, because it's happened 3 times already, we can't say it won't happen again, but short of another variant appearing that is A, resistant to vaccines, B, extremely transmissible, and C, causes serious illness, all those things, I can't see any serious problems with education or indeed the wider community over the coming months. So that's a bit of a garble, but I think broadly that's where we are and where we're going. Happy to any questions, comments. Oh yeah, kind of just building onto that because I can see what a lot of the questions are going to be about. Broadly speaking, this thing is so infectious that our test and trace systems are basically ineffective. You know, the rates really couldn't be much higher. And once it's in somewhere, it's in somewhere. So the test and trace. So we will have a lot of discussions, no doubt, about keeping children out of school and about how, whether it's 5 days or 7 days. But I think broadly speaking, all those things are kind of tinkering. And from a population public health point of view, the things just spreads like wildfire anyway. What's good news though, kind of, is we've now got it spread like wildfire in our care homes, and half our care homes, last time I looked, we've got outbreaks. It's probably more than that. But unlike last year, where that was dreadful in terms of serious illness, hospitalization, deaths, it is really not leading to much serious illness in care homes at all, which I think is one of them, well, is the most positive thing in my mind at the moment. So I will now promise definitely shut up.
No, please don't. We need you.
No, I'll answer questions, but I won't venture.
So Mike, just a general question about care homes and NHS. What's the sort of level of vaccination among, obviously care workers in care homes have to be vaccinated now, but are you aware at all about what the impact of that has been, whether they've lost staff and also whether NHS staff are vaccinating? So
they have lost some staff. Yeah. And therefore you see the rates going up and up all the time, but actually the rates are going up partly because the denominator is changing because people are leaving who are not vaccinated. So there are quite high, the rates now are kind of getting 90% plus, but they would do because you can't work otherwise. In the NHS, again, the rates of vaccination are high, the high 80s to 90s, hopefully will continue to go up. Yeah, I think there will be people who will be leaving those jobs, and that will cause workforce pressures that will need to be managed.
And are you pleased or positive about the uptake of vaccination and booster in Essex? Has that been? I know nationally it's gone well, but does that reflect within Essex as well?
So in some places it could have gone better. In some places it's gone really, really well. I think the most important thing for me, from public health point of view, is those people who are most susceptible to the disease. So the older groups, the 70 plus in particular, 60 plus, have been high levels of boosters and are well protected. And indeed we're finding that. So we've got levels well in excess of 90% in the most elderly populations. Vaccination is great. It goes to about 40% in the young adults, but I can live with that because actually they're less likely to become ill. Now the other thing is we know that this particular variant, the vaccines are not good at stopping it spreading and stopping you getting it. So there isn't really a population herd benefit in vaccination. The vaccination is to protect the individual. In this particular instance, it's a bit different for Delta, but in this case, really, you need the booster to stop yourself getting in and stop yourself getting to hospital, but your contribution to stopping the spread within the population is pretty minimal, really. So some of these things about having vaccine passports to get in to see Spurs, which I did recently, is kind of, it's a bit false, really, because it's going to spread anyway. And in fact, the guy I went with has got it.
Yeah.
Oh no. So there's a couple of questions around vaccines. So is there the remotest chance that government will mandate that school staff have to be vaccinated in order to work in school like they have with care staff?
So when you say the remotest chance, so if I was in charge, I'd say no, they don't have to, because actually it's not like you've got a very vulnerable group that you're in contact with, as you see elsewhere. So I don't think it'll be the case. Having said that, there's been, you never know, but I would say no.
Okay, and then a question around plan to vaccinate 5 to 12-year-olds. Is that something that's going to happen?
Again, if I had to bet on this one, I'd say yes, that will happen. Oh, I would have said a few weeks ago, yes, it was definitely going to happen. And there was actually discussion it was going to happen. It does appear to be have sort of slipped off the agenda a bit, possibly because we've actually sorted on. I can do the next one easy. This isn't as serious as we thought it was going to be. And also we can't really stop it spreading through vaccination particularly well. So the answer is I suspect that may happen, but it's slightly less likely to have happened than it would have done a while ago.
And then there's another question around unvaccinated staff, which might not be one for you, Mike, but that might be something, Pam, that we need to ask HR, because I know Nikki's not on this call. But what is the plans for what can we do for staff that are unvaccinated? Because every time they come into contact with somebody, they're then taking time off to isolate.
I don't think you can do anything about it, to be honest, is my understanding, but.
So I'll just come in there as well. That has been raised through the regional union meetings as well. So that's on the agenda, and Nikki Harris is involved in those conversations. So, I mean, it may be that, Mike is right, and we'll have to wait till isolation rules change, but that's on the agenda for conversations at that level.
Thank you. Mike, can you update us on advice for COVID and pregnant women?
I'm not sure that's changed.
Okay.
With you.
So still suggesting they work from home from 28 weeks?
That's my understanding, but I will look at that and get back to you.
I'm not sure.
Oh, okay, good. I've not seen
the latest advice that I had with a pregnant member of staff, so I'm assuming that is what it is. But
I can check that one offline. And
okay, thank you. Bets on reducing isolation period.
Okay, so I had this with Rafi, who's our health protection guru, the other day. Now he thinks it'll happen and I don't, but he's probably going to be right. Now the reason I don't is because this is copying what's happening in America, and they count differently. So they don't actually count from symptoms, they count from the test, which usually happens a day and a half afterwards anyway. So if you count from the test in America, so if you count from symptoms in America, it's about 6.5 days anyway. So and the evidence shows that if you go out of isolation after 7 days with the 2 tests, you're 5% likely to still be infected. If you go out after 5 days, you're 15% more likely to still be infected. So I don't think the government will swallow that. I don't think Chris Whitty will swallow that. So I suspect we'll stay at 7 days.
Okay, and then on that, can you just give us some recap really on the isolation time, because we're hearing day 0 and then day 1 and then what's day 6, what's day 10? I think there's a lot of confusion around that.
So if you've got the infection, then the next day that's day 0. So the next day becomes day 1. So it's when you get and the clock starts from either the day that you have the test or the day that, if you've got no symptoms, or if you have got symptoms, the day that the symptoms start. That's your day 0, whichever's the earliest of those two. If day 1 then becomes the next day. So you got day 1, day 2, day 3, day 4, day 5, day 6. If you take a test on day 6 and it is negative, and then you take another test on day 7 and that is negative, then as soon as you've got your negative test on day 7, you can leave.
Okay, I think that answers that question. And then there's guidance around if you leave before 10 days, then you're strongly advised to limit close contact and be in well-ventilated spaces, which can be difficult within schools. So what is the thinking around that?
Where you can, you should, but it's not going to happen in schools, is it? And the advice is very clear that it should apply to schools and school children as well. So there is a 5% chance of those people returning being infected anyway. But actually, you've probably got a greater than 5% chance of children being infected in your school and not picked up because they haven't been tested, haven't got symptoms. So it is a small increased risk.
Okay. I'm just looking through if there's anything that's just come in on the chat. There's a question around taking lateral flows and the time scale if you have had COVID, but then I think that's probably by doing the 6 and 7, isn't it?
Well, no, well, I think the issue is that you're not supposed to do a PCR test within 90 days of being positive for COVID, but that doesn't apply to lateral flow tests, and you're good to go with lateral flow tests as soon as, really. They're because of the nature of the way they work, they're less likely to be false positive than a PCR test would be. So yes, you can do them regularly, and children should do them regularly, even if they've had recent COVID. And in fact, my son does them regularly and had COVID over the summer.
Oh, okay, so PCR tests still shouldn't be done within 90 days of being positive?
Unless you've got symptoms.
Yeah, okay.
Harriet, can I jump in with a question just talking about testing and small children? I don't know if Travis is online. Travis, are you with us?
Yeah, in body and spirit.
Marvellous, that's perfect. Do you want to jump in and just ask the question about your under 5s? Not yours necessarily, but
no, mine are well older than that now. Yeah, Mike, we had a few, just for clarification, questions from our parents. Where we said we've got a case in reception, could you test the children? And basically they've come back and said that health workers are telling them not to test under 5s, and we've got quite a few. So I don't want to go against the advice of health workers, but I did say to some parents, if it was my child and I knew that they'd been in contact, I'd test them even if they were under 5. But
so my grandchildren, I'm afraid I'm that old, get regularly tested, and they're under 5. I think it's if it's not stressful for them and they don't mind it, do it. And let the nasal swabs are walk in the park, really, aren't they? So if you work for most children, so I yes, do with the under 5s, that's fine. There's no reason not to.
Thank you, it's perfect.
Sorry, I couldn't unmute myself then. If a member of staff still tests positive on an LFT on day 10 but doesn't have a temperature, can they return?
Yes.
Fabulous. Access to LFT testing kits, there seem to be not many out there. So I know there's a few schools that have problems getting hold of them. Is that the case, or is it just slow to be delivered, distributed?
It's hit and miss. So I think they're all there. So again, not as just from a personal point of view, because my mate's got it. I'm on the 7 days as is my son at the moment. You can, if you persist, you'll get them. So I had to go on I got them straight off on the site yesterday. A couple of days ago, I got rejected, but went back on the site later on and got them. So that, as often as probably about 2 times out of 3, you can get through on the national site and get them ordered.
Okay.
That's personal experience, rather than.
And I'd echo that as well, ordering tests both online and at local pharmacies. It's hit and miss. You can go on and then half an hour later they're available or not available. So I think it's just asking staff to be persistent, really, and parents.
You don't have to be that persistent, so 2 times.
No, there seems to be a lot washing around. Just to confirm, and I put something in the chat, the guidance around pregnancy has been updated, and there isn't specific guidance for 28 weeks plus, but it surprise is down to individual risk assessments and so on. Of course, they do become complicated, as we all know, when their health professional, GP and so on get involved and perhaps say they shouldn't be at work. We don't have Nikki with us today, but I just wanted to do a check whether anyone had any concerns around staff absence in the light of producing LFD tests rather than PCR tests, and whether there have been any issues around insurance for people, or any feedback from people on that issue? I don't know if people have come up against that yet. I'm suggesting that people do check with their insurance company whether that arrangement has changed, because certainly I think previous to the change on Tuesday, you did need to ask for a PCR test from members of staff, and you're unlikely to be, well, they don't need to do that now, of course. But do remember as well that there is a system of isolation notes that staff should be using if they're sort of self-certificating, which, as you also know, has been complicated by the fact that you can people can now self-certificate for 28 days, so good old chunk of time off if people want to do that, but definitely insist on the isolation note.
Can I just come in there? It's Isobel. Just to say that on the LFT front, before Christmas I had two, and just going into Christmas holidays, I had two staff who had positive LFTs and their PCRs both came back negative. So that potentially could affect us now. We're in this different system of LFTs. In terms of insurance, our insurance company won't pay out on any COVID-related absence at all. So yes, it's becoming very costly as well as difficult to manage staff absence.
Mike, do you have any comment on that, the effectiveness of LFTs? Because one seems to hear very conflicting reports on that. Of course, not surprisingly, government at the moment saying they're marvellous and they're very accurate, but anecdotally at least, plenty of people have conflicting views.
So there are two different things. There's whether or not an LFT that is positive definitely means you've got it, or whether there's an LFT that is negative definitely means you haven't got it. So the big worry in the past has been that the LFTs, when they're negative, you could still have it. And that's still a bit of an issue, because it's better than it used to be. It's probably about 20% of LFTs that are people who are positive will end up with a negative LFT. So you miss a fifth of cases. In terms of the other way around, particularly at the moment when we've got very, very high levels of real COVID within the community, the chances of a positive test of an LFT not being because you've got it are really, really, really remote. That's why they stopped PCRs. One of the key reasons they stopped PCRs. So basically a positive LFT test basically means you've got it.
And so there's a question in the chat about if a child has had COVID, then come back to school and a month later tested positive, is it likely that they've caught COVID again? Because the parents are insisting that it's because they had COVID before.
Okay, so a whole bunch of stuff. So are they doing, if they're doing regular LFTs, the LFTs should have gone negative. And then if they've been negative and then they go positive again, they've got it again. If they have not had an LFT and then had a PCR, why have they had the PCR? Why have they not done the LFTs? And then it is possible that they've got a persistent positive PCR. It may be worth doing an LFT then, because if the LFTs are positive as well, then it probably is another infection. The other thing is, well, if you've had it once, are you likely to have it again quite quickly? And generally no, but at the moment probably yes, because the issue at the moment is we've had the deltas, and if you had delta in the past, it's very, very possible you could get Omicron straight away after it, because having delta doesn't give you much protection for Omicron. So three things. First of all, when was it? If it was quite recently, then yes, it's entirely possible you could have delta and then get Omicron. It's unlikely you get two lots of delta. If they've had LFTs that are negative in between and it's an LFT that's positive, then it is likely they've got the infection again. If it's a persistent PCR positive, then that is a possible thing.
Thank you. And then Helen, do you just want to expand a bit more on what you've put in the chat? Is this in relation to Pam's comment about 28 weeks pregnancy?
Hi, Harriet. Yes, it is about that, because as I've Mike has said one thing and then HR is saying it's down to the risk assessment. We're not experts. Mike, we defer to you on these matters. So whilst you're here, what should schools be putting in their risk assessment around pregnant employees?
I think broadly speaking that it's a cop-out. I think I suspect if they've been fully vaccinated, then their chances of having problems are very remote. You might want to look at how much COVID there is at that time in the school, but then and maybe if the rates go up, sort of say, well, work from home for a bit. I think that's how I'd manage it.
And just to add to that, obviously, then there would be a an aspect around anxiety and to take into account there as well. The unions would put forward, I'm sure. So to consider the anxiety of that member of staff within your risk assessment for them as well.
So
can I just jump in there? That's
can you just say what you mean by cop out, Mike? I want to be clear on that.
So I think that actually in a lot of areas there is a reluctance to give a definitive answer.
Yes. Right. So, and your definitive answer is at 28 weeks they should be in school if they're fully vaccinated. If
the government are saying that should be the case, subject to a risk assessment, what they're basically saying is that should be the case, but they're not prepared to do 100% in case there's a particular reason why that person might not, which is individual to that reason. It's very specific, right. And I can't think what that would be unless they've been immunosuppressed or you have extraordinary high levels of COVID within your school. Otherwise, so broadly, I think I would say except in exceptional circumstances.
And I think in the reality of the situation, any employer who was trying to insist on a pregnant woman being in school, who didn't want to be in school, would be on a very sticky wicket, and that pregnant woman would go to a doctor's and get signed off anyway.
Yeah.
So there's no point fighting a battle that you're going to lose and be embarrassed by.
And I think it's a really good idea, because in terms of the cop-outs, the other cop-out is go and see your doctor and see what they say, because they know your clinical condition best.
Yeah. Okay. Thank you very much.
Thank you, Matt. Do you want to come in?
Oh yeah, hi there. I was just going to concur with Alan. I think really that I've got 2 pregnant staff, both entered their 3rd trimester between start of the Christmas break and start of this term. One with some underlying health conditions, the other with none, and they were both very clearly advised by their midwives that they shouldn't be face to face in school. So I didn't really feel I had anywhere to go with that prior to Christmas. So there is I think someone else, there's a massive cost implications. Obviously, there's no insurance for that, so that's cost us about another 16 grand for 6 weeks worth of cover before maternity is even factored in. So I hear what you're saying, Mike, but I think in reality we haven't really got anywhere to go with it.
No, I fully accept that. I fully accept that.
Thank you. So a question in the chat about positive numbers increasing in classes. Are we supposed to contain them like with bubbles, or just carry on with protective measures? Do you have any thoughts around that, Mike, please?
So you got positive. So you should be identifying, or close contact should be identified by the National Test and Trace. That's how it's supposed to happen. But actually, you're probably better placed to do that. And those children should then have regular daily tests, but can attend the school. If it's hard to do that, it may be worth asking a wider group to take regular tests for a few days. If the cases are rising, I think that's the action I'd take. I wouldn't take it to anything more draconian or dramatic than that.
So, and the message from the DfE and Secretary of State is very clear around collapsing staffing to keep collapsing classes to keep schools open. Obviously, we've worked with the set workforce so that they're there to support conversations around that, because there's also a quality of education argument if you're collapsing classes in loads of different year groups rather than moving to remote education. And obviously, we wouldn't advocate collapsing classes so you've got loads of children rammed into a room that is supposed to be there for 30 and is already difficult to ventilate. So the SEPs are there to support you with those decisions.
Catherine, I'm being really stupid, but what do you mean when you say collapsing?
So where before
mixing them, or
so where before we would have said, or potentially you might have been advised by Track and Trace to go back into bubbles, particularly at the end of last term, that is unlikely to happen now, because the direction is very much that yes, you put classes together and mix them together to keep children in school rather than sending groups home to remote education as one of your steps before you do that.
So how does that align with the very clear union guidance that has come out, probably unhelpfully, but to say that actually teachers shouldn't be covering, or staff shouldn't be covering for classes that they don't normally teach? How that guidance seems to be very contradictory there.
Yeah, again, we will pick that up again on Monday at the union meeting. We didn't really go, we didn't come too much on issue. Alan might want to come in here. But it's around that kind of rarely used, becoming regularly used is also obviously an issue. I think the argument is to keep the children in school, to avoid impact on the NHS, and so on and so forth. And if we can't keep the schools open, then that has a knock-on effect. So it's finding a middle ground, and obviously not forcing staff to do anything, but to work with your staff in those situations. But absolutely accepting and acknowledging that is difficult territory for you to navigate. And as I say, the SEP team is there to help you with that.
Let's go back to Mark's question for a second. In terms of Mark's question here, though, no, you don't have to, you shouldn't be trying to contain them, I don't think, because it's just everywhere anyway. It's just the testing that you should be offering.
Thank you. Andrew, do you want to come in?
I was just going to say, Catherine, you talked about sort of mixed messages. The last thing I saw before leaving this morning was the BBC showing a sports hall with 2 classes in there. Each secondary school child sat at a desktop with a laptop, headphones on, and one teacher paroling. Totally impossible at any primary school I know of, any infant or junior school I know of. As I say, the classrooms are built for 30 if we're lucky, so no space whatsoever to mix.
Yeah, absolutely. So I mean, it's really a situation, you know, if you got to a situation where you had significant staff absence, and you would then also had significant absence in your children. So potentially if you had 10 children left in your year 4 class and 10 children left in your year 5 class and one member of staff, you can put them into a room together because you're not exceeding what you would normally have in that situation. Secondary schools, as you rightly say, have potentially more space to put larger groups but into bigger spaces. But we would not be expecting you to cram 2 classes into one classroom and do things like that. But we do have to acknowledge that the DfE direction has changed and is suggesting that we do put classes together to keep children in school.
Can I just go back to defining what bubble is, because I think there's sort of questions about bubbling or not, to bubble or not to bubble. My understanding of bubble is a group who are treated as a single unit in terms of isolation, and that's all it means. Is there another meaning that I'm missing here? Yeah,
so you're not missing it, right? But at the end of last term, so we would, particularly towards the end of last, I mean, we've had bubbles all the way through, but particularly towards the end of last term, we were seeing schools advised by Track and Trace to put year groups back into their bubbles. So children who had then previous to that been able to mix more freely around the school as per usual and pre-COVID had been advised to go back into their bubbles where they were usually in their class, in their year group, contained that way for playtime and everything, and not mixing with other groups within the school. And we're saying that is not something that's being advised now.
I don't think it worked, to be honest.
Okay. So there's just a question here. Do you still need to get a PCR test if you have symptoms? I think the answer is yes, but Mike, can you just confirm that?
What was it? Sorry, I missed that one. If
you have symptoms, do you need to get a PCR test?
Yes. Well, the thing is, this is always a really tricky one. If you have the famous trio of symptoms, then you're supposed to go straight for PCR. What the reality is that most people are getting a bit of a headache or a bit of a runny nose and are having an LFT because they have LFTs anyway. And then are being found to be positive in that way. But the danger is if you're negative on that, you may still have it, but it's only those, if anyone has a cough and cold goes for PCR, you're going to, a cold or a snotty nose and goes PCR, we're going to run out of PCRs very quickly. So if you have the traditional symptoms, definitely go for PCR.
Okay, and then could you just go over the guidance for unvaccinated or not fully vaccinated staff? Because I think there's a bit of confusion around. Before, we were being told that they had to isolate for the 7 days or 10 days or whatever it was. Now I think we're being told that they can test for every day for 7 days. Is that the case, or do unvaccinated staff have to isolate at home? Because as you said, Track and Trace won't necessarily be able to have the capacity to identify all of those as it's so rife at the minute.
So I will check this one up, but certainly the last time I saw it, if you weren't vaccinated, you had to isolate. But I will look at that because things do change quite quickly.
Okay.
It's my understanding that there's no change to that is still the same, Mike. Yeah.
Okay, so a member of staff in class with a positive case that's not vaccinated has to isolate for 10 days.
10 days, yeah.
Okay. Thank you. I'm just going through the chat. Pam, is there anything else on the list that you sent through? I think we might have covered everything, but I'm just going to check the chat, if you can just check that.
Sure, I'll just have a quick double check. We've been dancing around a little bit. Ventilators and air purifiers. So just any comments, I suppose, general comments, Mike, about ventilation and air filters and so on. And one of the issues that has come up is that in halls and so on, where you've got a higher proportion of children, readings are higher, and then also one came up yesterday with some colleagues where a head teacher it's an old building with very high ceilings, and in fact they're finding the readings are higher because her understanding is that the CO2 drops and the oxygen doesn't, or something. I may have missed exactly what she meant. So their readings are really high, despite the fact that it's big classrooms. So basically, it feels like a very inexact science. So do you have any sort of scientific advice around ventilators?
I'm not particularly. I think they are helpful. The suggestions are purifiers are helpful. Keep the place ventilated if you can. But I agree, it is quite difficult to be precise around this, and how important is that? Again, I'm not sure. It helps a bit, but I just think this thing at the moment. I'm not sounding defeatist, but it's just so infectious that and a lot of the spread is person to person, and it's very, very quick when it happens. And it's not just happening in the schools at the moment. It's been the highest rates have not been in the schools, although it is now in the school children that we're seeing the rates go up again. So I would keep ventilation as well as you could, and if you get them purified, it's great.
So when you say, Mike, that it's out there and it's rife and it's infectious, so as you can as has appeared in the chat, and certainly people are saying that they're being recommended by Test and Trace, or advised by Test and Trace, to keep children who are infectious away from other children and so on, and are you more or less saying that this is sort of just, I suppose, bolting the stable door, really, and actually some of these measures are probably unnecessary to try and manage that?
It's not so much unnecessary as ineffective. And certainly on a population point of view, we have never had higher rates. The thing is everywhere. I think it is going to go up in schools again. I think it's probably going to go up in schools again no matter what we do. Yeah. And then it'll go down again. So the important thing is what you're trying to do. And I think what we're trying to do is protect the NHS and the capacity of systems like that, so they're not overwhelmed. And the way to do that is just to get everyone vaccinated and to slow the spread. You're not going to stop the spread. I don't think you're going to protect people from getting this. If they're going to get it, they're going to get it, to be absolutely honest with you. And I think that actions in school are unlikely to really affect the shape of the curve of this thing, would be my view, on a grander scale.
Yes, I mean, obviously, I think the problem for schools is that it's almost, we're trying to do two opposite things, aren't we? So by actually, the logical conclusion, if we're protecting the NHS, is to close schools and send everyone home and isolate everyone again. That's absolutely the diametric opposite of what the DfE and government are saying, where they want schools open despite the infection.
Well, the question is, are you protecting the NHS?
Although children don't get sick, I don't think it's changed that they do spread COVID. So
yeah, but I think the question is, are you protecting the NHS by closing the schools, particularly? Yeah. You're just slowing it down. Actually, the NHS can seem, touch wood, to be able to cope at the moment. If the NHS start to struggle, then there will be a need nationally to put in effective restrictive measures, which would maybe stopping families mixing. They might be closing schools. I don't think we're going to get to that place, because I think generally the NHS will cope, and that the peak won't be as high as we might expect. All we can do is flatten the peak. I don't think we can stop people getting infected, other than through the vaccination booster program, which I think is running out of steam anyway, because I think the base people who want it have got it. So why are we doing anything? No, I think that's a really good question. I think you're right. I think, and are you keeping your teachers, teacher class in health? See, I'm not sure you're there are people who are not going, who you might stop them getting it today, but they get it tomorrow. I'm not really sure on a population view that this curve is just going to go down anyway. We might mitigate it very slightly. So it is a very difficult one. I think I can see for people who are protecting their individuals that there might be some limited benefit, but from a wider population view, it's probably not going to make much difference.
So, Mike, do you have any view, and this is a million-dollar question really, at what point are we as a nation or even globally going to just live with COVID?
I think we're really close to it. I think we are really close to that point.
Right. So,
and I think that should be so at some point,
the common cold, and we just live with it.
Yeah. So at some point, I think we're going to be stopping the testing and I
think more importantly is stopping isolation and so on, because that's obviously what has the huge impact.
Well, we've pretty much stopped that already, haven't we? Except for people who've got it themselves, they have to keep away for 7 days. But contacts don't have to isolate anymore. So I think we will be getting to a place soon where we will be using vaccine as the main driver for this, and we won't be having many other measures. And I would think once this wave goes, we're pretty close to that.
Andrew, is your hand up for a new question or from before?
Sorry, before, forgot.
That's fine, thank you. So Mike, there's a few comments in the chat around unvaccinated staff and isolating or not isolating.
They have to isolate.
Okay, so that's
not if they're a contact. So that's if they are positive. They don't have to isolate as a contact.
No, they do. They have to isolate as contact.
That's why I'm asking for clarification.
No, that's what I'm saying.
Because if you're unvaccinated, Mike is saying that you have to isolate for 10 days if you're a close contact to someone that's tested positive. So if track and trace don't contact that person, but as a head, we know our staff have been in close contact, that's our responsibility to then tell them to isolate for 10 days. Is that what we're saying? Because you just said that track and trace wouldn't have that capacity to contact everybody.
So this again gets quite tricky, because actually you're talking about what is the legal position and what is the appropriate public health position. Now the reality is, I don't think that being vaccinated or not being vaccinated particularly impacts on your infectivity as an Omicron, if you've got Omicron. I think that there is a legal position, though. If you're unvaccinated and get contacted by test and trace, then you have to isolate. But if you're not, but of the legal position, if you're not contacted by test and trace, you don't. So it's a really difficult position, I think, for you guys.
Yeah, and you're not asked to track and trace anymore, so I think you're not in a position to do that.
And I agree with that, but I think the problem is, as head, we have a duty of care to our staff, and if we know they're unvaccinated and they've been in close contact with a child who's positive, where does that leave us? I'm going to bring Claire in because she's got her hand up, and then I don't know if it's M. Keeling, sorry. So Claire first.
Yeah, it's actually Gina Bailey we're sharing.
Okay.
So we have exactly that situation. I've got an LSA who's a close contact of a child who's tested positive on an LFD. We told her this morning that she would need to isolate for 10 days, and she categorically said she did not want to. She felt that for her mental health and well-being, she wanted to be in school. She had COVID in November, doesn't feel that it's a risk, even though she's not had vaccination. She's going to LFD every day for the next 7 days, and we've completed a risk assessment. I mean, and she really is very clear she doesn't want to go home. So we sort of made the decision this morning that we've done the risk assessment. She's socially distanced. And she's, high levels of hand hygiene, and we've agreed that she can stay. Do we change the response?
I think
that's right. I think from a public health point of view, I don't think she's particularly at higher risk than somebody who has been vaccinated in passing the Omicron on to anybody else.
But from a legal point of view, and I've just been rereading the self-isolation guidance that is out there at the moment, and from a legal point of view, she's unvaccinated, Therefore, she needs to isolate for 10 days, and that shouldn't be your decision, Gina. That
Yeah.
So isn't that, Pam, she's not been identified as a contact.
No, there's no test and trace. And when we read the HR guidance, which we read about 50 times this morning, it does say, if you are not contacted by test and trace, there is no need for her to isolate, even if she's unvaccinated.
Well, there's no legal reason for her to have to. So you couldn't, it would be difficult for you to exclude her. I agree.
Yeah.
That's where it gets a bit of a muddy water though, doesn't it? And it comes back a bit, Mike, to your term of, well, that's a bit of a cop-out, because track and trace wouldn't be able to trace them because the child isn't going to say, yes, I've been in close contact with that person. And that's where it becomes a bit of a grey area, isn't it? So as a duty of care, do we not have a duty of care to either do what you've done or to say, well, you have to isolate? And it's really difficult, isn't it?
I think you've done exactly the right thing. I think you've done exactly the right thing. You're not in a position to say you have to isolate. You're not in a position to be able to do that. So you've done exactly the right thing to take the steps you have and then to complete the risk assessment. Because it would be, you're not in a position, you don't have that jurisdiction to make that call.
And if she's doing the daily, if she's doing daily flow test.
So if I just record on the risk assessment that she has said that she doesn't want to isolate for mental health and wellbeing reasons, this is the action we've taken, and then that should be suffice.
And she's doing daily lateral flow tests.
Yeah.
Because actually, if she gets infected, she'll be picked up just as quick as anyone who's been vaccinated.
Oh yeah, exactly.
And the Omicron, if somebody's infected, they're infected.
Yeah.
So you're acting in line with DFE and public health guidance completely.
Yeah. Michelle, do you want to
stop panicking now?
Michelle, we can't hear you. Sorry, you sound a bit like a Dalek.
You want to pop it in the chat, Michelle, if you can't, yeah.
Okay, so looking at the chat, I think we probably have covered quite a lot of things. Is there anything else that anybody wants to ask in person or to put in the chat, or anything that you feel hasn't been covered in enough detail?
So at Sam's point, I'll be honest with you, I think they just want people vaccinated. It's the same as going to see Spurs. You've got to have a vaccine passport to get in, but the reality is that it was different for Delta, because we knew in Delta that being vaccinated reduces your chances of spreading it, but the chances of Omicron, the Omicron vaccine doesn't particularly help you stop you from spreading it, and it spreads so fast anyway.
Okay, so Michelle's point is that she's in the same situation, 2 staff out as they're not vaccinated, but was told by track and trace to send them home. They don't want to be at home. Can they come back if they're in need of staff? And I suppose conducting a risk assessment like the other school have said that they've done. Michael, Catherine, do you have a view on that?
There is no, if they haven't been contacted by track and trace themselves, then there is not a legal obligation for them not to be at work. It's for you to decide, how you want to manage it, I'm afraid. But actually, if they want to come back, they could come back.
But Essex track and trace have called as part of the line list. So does that mean they are a close contact and have been identified by track and trace?
No, so if they haven't been contacted by NHS track and trace, and they're not legally obliged to isolate, as Mike says, as a contact, we'll follow that up with Essex track and trace. Can you just let me know which school you are as well, so I can just follow that up directly? Just so we're making sure that all the advice coming through is aligned. Thank you. We'll follow that up.
And then it would be useful for that to come out to all schools, because it would be, because we're all in that position, so we all want to be doing the same thing by our staff, don't we? So that will be really helpful.
Yeah, no problem.
Natasha?
Yeah, thank you. I just put it in the chat, but I'm just clarifying. Union guidance are readings below 800 on the CO2 monitors, but actually the device itself says that normal is up to 1200. What's the actual kind of guidance on when we're suggesting that CO2 levels are unsafe?
I don't know that. Sorry, we'll find out. Someone's saying 1500.
Yeah, I thought it was 1500 as well. I thought that was what was on the monitors. So
that's really helpful. If it is that, that's really helpful. Thank you.
Yeah. Okay. Catherine, anything from you?
No, I don't think so, other than to say I am very aware this is, muddy waters, as it always has been, and you are doing an incredible job, and we take our hats off to you, and thank you very much.
Catherine, I think it would be helpful. Obviously, after this, I'll send the recording link to everyone. And would it be possible, do you think, for it to be shared with Track and Trace? Because obviously, one of the issues that we always have is sort of contradictory guidance, not through anyone's fault very often, just because things change. So it might be helpful if they've sort of heard the advice that we've had from Mike and colleagues and understand what head teachers have been told.
Yeah, we can do that. I mean, it's usually, we pick up the issues anyway. So if we go back and pick up rain, then I think we'll probably be able to iron that out. Obviously, they're all linked through to Mike anyway. So it's usually just, just slight variance in advice, isn't it? But I'm absolutely aware that doesn't help anything. So we'll try and iron those out for you and come back to you, definitely.
I think just overall, we're in a very, very different position than we were a year ago. I mean, a year ago, we had a virus that was causing huge amounts of illness, huge amounts of hospital admissions and deaths. And we needed to contain it at all costs, which means we had to close the schools. We had to put in quite draconian, closures in society. We're in a very different position this year, where we've got very, very, very high rates of the virus with very, very strong protection from vaccine on it. And we really want to keep those schools open as much as possible. So I think it is a extraordinarily different position and a very, very different adversary in this virus in terms of the main issues here are staff going off sick, I think, because so much of it around, rather than the illness, the severity of the illness that's causing.
Mike, a final question in the chat. Is there any recommendations on singing or not from Essex?
Well, it's the same. I'd sort of, to be honest, I'd sing. Goodness sake. So, I mean,
singing it is then.
When are we going to stop? When are we going to say no? It's not. It's safe to sing again. I mean, come on. This thing, this is not like the original Wuhan virus. This thing, you just have to look at it funny and you're infected. So whether you're singing or whether you're whispering is not going to make a huge amount of difference. I just think this thing is so bloody infectious that it's going to be out there anyway, and we need to start to live with it. And I think we are in that place now.
Okay. Yeah, you're not filling us with confidence there, but okay.
About what? No, about what?
I think the opposite. It's very positive.
Can I just come in there? Because something, Mike, I think you said to unions the other day, I think, or it might have been a different board, apologies, but it's around the fact that the Omicron has really overtaken Delta. So I think that's a reassuring fact, isn't it?
Well, there's no Delta. There's no Delta now.
Yeah. So that is a reassurance, I think, in line with what Mike's saying about learning to live with it.
And this will go away as well. This will peak in mid-February, and then it'll drop off and disappear. And then we'll wait for the next iteration.
And I think that is it, isn't it? It's about living with it and moving on, really. We can't keep on.
You're not keeping on, Harriet. Harriet's
given up. Quite right. Come back, Harriet. All is forgiven. I'll just jump in then, and that final question which Harriet's already asked, are there any more questions, or is there anything that people don't feel have been clarified at this point?
Can I just say something? And I know Harriet has just gone, but she'll be back in a minute. Yeah. Helen from Writtle, I think we must just understand that heads are very, very stressed about this term. And I know what you're saying, Mike, we've got to live with it, but we're still going through that peak. And I think we must acknowledge Helen from Writtle. So thank you for putting that yeah, it is very challenging. There's more staff off. There's not a lot we can do. And we are feeling quite isolated, I think. So any funding you can give us head our way, considering now the insurance companies are backing off, would be brilliant. So any pots of money anywhere would be fantastic, because we are working our socks off yet again. And it's lovely that you're working at home. We're not. We really do need some backup from you guys. So perhaps another letter out from the local authority about what the situation is in Essex would be helpful for primary heads, please.
Okay.
Yeah. Thank you.
I appreciate there are different challenges, and there's still challenges. And absenteeism is a challenge at the moment, but again, hopefully that will improve within a few weeks.
We hope so. We really do hope so, Mike. And we do really appreciate you coming here. You're our guru. But I just wanted to acknowledge that, because I really do feel that staff absence is going to really drain us this term more than anything. So
yeah, I agree.
Yeah. So just to reiterate, Dawn, on the back of that, the SEP workforce are there. And we absolutely anticipate that this might, be the calm before the storm in terms of staff absences and those difficult decisions about groups in remote education and so on and so forth. So just pick up the phone to SEP and make sure you're using them for their support as well.
I don't think it's going to get any worse. I think it's going to start getting better now. That would be my view. I think we're starting to see the peak in Essex.
And given that this is beginning to sound positive, which is great, but Catherine, I guess as well, a message back to other colleagues in the local authority to, I know at the moment because I guess we're still under Plan B, that those colleagues in the LA who can work from home are working from home, but I'm still getting a lot of emails from schools saying, I need my EP in school, or I need X, Y, and Z. So please, can we take that message back? We're still hearing from different members of different workforces, no, we're not allowed back in school.
Yeah. So you shouldn't be
but
hearing.
We are.
Okay, we do need you to raise those issues with the AD. So the corporate guidance is very clear that for those frontline workers, social care and education, we carry on as business as usual. So we should be visiting schools. There may be situations whereby through COVID, for example, the EP service have looked at things and ways that they might be able to do slightly different to be more effective, given a small team, not at capacity because of recruitment across such a large county. And there may be things that they will suggest that they do virtually, but it is absolutely not the case that staff from Essex should not be coming into your school. And if you do get that situation, please raise it with your head of education, your SENQM and your AD. So that
Does that include SEPs then as well? Does that include SEPs, Catherine?
Absolutely, yeah.
No, well, that's good to hear very clearly, because it is still happening. There's still mixed messages out there. And I think in many cases, that would be a very positive way that head teachers would feel supported. Not that they're not feeling supported by the LA, but that would add a sort of additional layer of practical support, which is often what schools need.
100%. And, we are absolutely here for you. And for most of us, we relish getting into schools, I can assure you. So, we are absolutely, that is what we're here for.
A nice class year 6 then? Nice class year 6 for somebody?
Exactly. Perhaps have a swap with a head teacher day. That might work.
I'm happy. I'll do that.
I know you would. Yeah, I know you would.
So, Mike, you have your hand up, but is that just because you enjoy waving, or do you have a question?
I do enjoy waving. I often wave at weekends, part of a waving club. But no, I was going to ask, you mentioned, thank you very much, Mike, it's really great information. But I was going to ask, you talked about the son or daughter of Omicron. Are they naturally going to be weaker, or could there be a more virulent strain?
Could be a more virulent strain. We don't know. But I say it's the balance of three things. It's got to be more virulent. So the most virulent, well, they've all been similar. This one's been the least virulent, but it's going to be more. It's going to be virulent. It's got to be infectious, and it's got to dodge the vaccines for us to worry about it. It's got to be the three of them. So the South African variant, which came this time last year, actually, the beta variant, was the one that really dodged the vaccines big style and would have caused us huge problems, except it wasn't very infectious, so it never spread. So you need all those three things together. But if there is a possibility you will get something that has those three. It wasn't Delta, it isn't Omicron, it wasn't Beta. We haven't had it yet. We might not.
Yeah. Thank you.
Okay, I think on that note, we haven't regained Harriet. So on behalf of Harriet and everyone, huge thank you to Mike and Catherine, and to other local authority colleagues. Thank you, Anita. Please follow up. I'll send out the recording as usual, and please follow up with any further questions you have. We'll talk to Mike and also Claire about doing another webcast later in the term, if that's what people would find helpful.
I probably won't be doing it, I'd just like to say.
Are you escaping at last, Mike?
Hopefully, yeah, within the next, I would think this may be my last one. May well be my last one.
Well, then a huge thank you from us for supporting us. It's really been appreciated. We know you're quite busy, so thank you very, very much.
So my
Can I say
replacement
thank you
will
on
be.
behalf of EPHA Heads, Mike, as well. Thank you very much. This is the one thing I don't miss each month, and you have kept us really sane through all of this with your very common sense that you talk and your expertise. So thank you very much, and good luck with
My replacement is very good as well. So hopefully you'll be
I'm sure.
meeting them soon.
Thank you for your time and your expertise.